call the honourable member for Hunter.
Mr. Deputy Speaker, facilitating access to affordable health care should be amongst the largest priorities, top priorities of any government. A government which fails to provide access to affordable health care risks having blood on its hands. And too many people in parts of my electorate now are struggling to gain that access. In a short period of time, more than 1,000 people have signed my online petition calling upon the Morrison Government to revisit changes it has made to general practice and Medicare services. Large areas in the Hunter electorate will suffer if the new system for determining where bulk billing incentives apply and where overseas trained doctors can work. Towns in both the Cessnock and Lake Macquarie LGAs have been adversely affected. Cessnock, Kurri Kurri, Morisset, Wangi Wangi, Cooranbong, Dora Creek, Bonnells Bay, just to name a few. Community health care and Waratah medical services are two great practices which extensively offer bulk billing services. They are now, of course, under pressure, Mr. Deputy Speaker. Their economic model has now changed because of the government's decision. And it is true that some people will now be declining not to visit a GP when they genuinely need to visit a GP because they simply can't afford to do so, because the bulk billing services they've become accustomed to will no longer be available. So, Mr. Deputy Speaker, some of these practices have ageing GPs as well. Waratah GP services in Morisset being a typical example, and they are unable to find new doctors now. But now that has been compounded by the changes under this modified Monash model, which rates towns in my electorate on the same scale as Mossman on Sydney's North Shore. This is crazy, Mr. Deputy Speaker. Waratah Medical Services and those providing similar services in the Cessnock LGA can't afford to provide those quality health services at cheap rates without the support of this government. So I again call upon the government to revisit this issue to ensure that the boundaries for determining these things reflect the reality on the ground, and therefore to ensure that people in my electorate, particularly in those working class and ageing communities, have access to the medical services they deserve and need.
Yeah.
I call the honourable member for Dawson.
Much.